Right now, the first, a new study says opioid painkillers do not help most people with pain. And a popular anti-nausea drug that many pregnant women take for morning sickness is now linked to a rare but serious birth defect. I want to welcome Dr. Anita Gupta, who is an anesthesiologist and pain specialist this morning. Welcome here on Skype from Princeton, New Jersey. Now let's start with opioids and pains. A review of 100 clinical studies finds opioids don't work for chronic pain unless that pain is caused by cancer, but we know that opioids are prescribed for well beyond cancer patients. What are your thoughts on that?
That's right. And, this study just tells us that we need to really do more and raises a lot of questions. I mean, as you know, acute pain is also a very serious time during surgery, and opioids play a very important role. And what we really need to focus on now are what are the alternatives during acute pain, and really there aren't many. But opioids serve a very important place. This surgery that are being performed throughout the United States are many, and we need to find new options. So right now, there aren't many other than opioids. The study just raises a red alarm that we need to find more new options other than opioids.
And so, again, these are, several hundreds of clinical studies. It's not a new guideline or anything. Would you still, as a medical professional, prescribe opioids for short-term pain?
Look, my own patients as an anesthesiologist, opioids are the first line drug in the operating room. In the most acute settings, opioids play the key drug. But what else can we give? And this study just raises the questions. There are many populations of patients that we serve. We serve women, we serve young children, and what else can we do for those populations? And these studies are really broad populations, and we really need to narrow our focus, look at various populations of patients, and see what works in different populations. Now, opioids might be good for some, but not all. And for example, what works in young children, what works in women, and what works in these populations are really going to change and move the needle for these individuals.
And the other breaking story this hour in the news and health, the popular anti-nausea drug Zofran, it's now linked to cleft palates in newborns, although the risk is said to be small. Kind of bring us up to speed on that.
That's right. And as you know, Zofran or ondansetron, commonly used again during surgery, and anesthesiologists use it to prevent nausea and vomiting during surgery, commonly used around the world. And this raises some questions. During pregnancy, women may get this as well. And women need to ask questions. If you're about to have a child, are you going to be getting Zofran? And are you going to be getting this drug? Certainly, this study is one of many that probably will occur. And I know that patients will be asking a lot of questions, but, we need to investigate drugs in general. And whether it be Zofran or whether it be any other drug, we need to understand that drugs are chemicals, and they cannot be, but they all have risks and benefits. And whether it be Zofran or any other drug that we use in the operating room, or whether you're having surgery or having a child, we need to be careful.
And, we know that Zofran is also used by cancer patients. Is there a risk here for just pregnant women or both?
Well, potentially. I mean, we're talking about cleft palate, right? So at this time, this particular study is looking at the risk for cleft palate. But in general, I mean, when we're looking at cancer patients, Zofran also is very commonly used, but we know it's very effective. And the whole category of antiemetics can be very important. And this is another population of patients that seriously needs to address nausea and vomiting, because as we know, chemotherapeutics during cancer can increase the risk of serious nausea and vomiting.
All right, even though that risk is low, it's still an alarming side effect. Dr. Gupta, thank you.
You're welcome.